Right, let's get started. I'm going to pass over to George. Good afternoon, George.
Good afternoon, Rich, and thanks everyone for joining. So I'm George Doyle. I'm part of Kaleidoscope Health and Care, where I lead on systems and collaboration. Prior to joining Kaleidoscope, I spent about 10 years over in America supporting and studying networks, clinical networks, and what makes them fly or flop. So as you can tell, I'm really passionate about networks and collaboration. Over the next 44 minutes or so, we're going to be spending a lot of time talking about the how of collaboration, getting really concrete about what makes collaboration work. But before that, I wanted to spend a few minutes thinking about the why. Why do we collaborate? I've recently been reading this fantastic book called Super Cooperators by a chap called Martin Nowak, who is a professor of maths and evolutionary dynamics at Harvard. And he notes that it's common to think about evolution in terms of survival of the fittest. And with that fitness comes strength, comes power, and comes control. And I've been thinking about the application to kind of our current landscape in health and care, where a lot of our mental models involve thinking about power and control and hierarchy. Interestingly, it's as Nowak kind of points out, top-down control doesn't actually apply so much to biology. And if you plot to the next slide about early studies of migrating geese, we used to assume top-down leadership was taking place here, and there was one goose leading the others to form a V to migrate across the Atlantic or wherever. And to prove this theory of top-down leadership, some biologists went out and they shot one goose. And sure enough, another goose took its place. And they assumed, oh, well, that's just the deputy kind of stepping in and applying that same top-down leadership. So they shot that one down too, and another goose stepped in. And what they eventually came to learn is that geese flock not because of the power of the sole leader, but because of aerodynamics and the selective advantages of corporations. Fortunately for us, we have evolved as human beings to become super cooperators. And as early hunter-gatherers, we really needed to collaborate and work together in order to survive, in order to bring up our children, in order to gather food, in order to hunt animals and fear off other predators. I don't know how many of you enjoyed a morning coffee this morning, but if you think about the thousands of years of kind of collaboration passed from generation to generation that made that coffee possible, from farming and growing and processing and supplying, let alone just a business that actually sold you the coffee. Yet, despite this kind of rich evolutionary history and that collaboration is very much in our DNA, we're still struggling. And that's why 50 or so of you have turned up this afternoon. And Nowak, in his acknowledgements at the end of the book, he says it's kind of a lovely and intoxicating thought that it takes a high degree of cooperation and collaboration to understand cooperation. And I'm so delighted to be joined by the other speakers today and all of you today to explore how we can understand collaboration at a deeper level. So what do we mean by collaboration? If you pop to the next slide, Rich, you can see our definition up here. So at Kaleidoscope, we define collaboration as working with others to create value together. And if you flip to the next slide, we say that this value can be created in four main ways. So there's four ways we can create value when we're working together as a collaboration. Number one, we can share voice. So this could be social movements, or this could be partners working together to lobby for, let's say, more funding and speaking with one shared voice. We work together to align plans, make sure we're not duplicating effort, stepping on each other's toes, and making sure that our approaches are coordinated. By sharing learning, so what's the best practice? How can we learn from that? How can we share? How can we learn from what hasn't worked and stop others making the same mistake? And then finally, bottom left, to share delivery. And so to work together to create something new together, a new pathway perhaps, or a new service. It's important to think that these aren't in competition with each other. They're not kind of mutually exclusive, and they might well change over time. So I've recently worked with a group that came together primarily to create value through sharing delivery, but they realized actually what they really needed in order to do that was some additional funding. And so they spoke as one voice and were able to achieve that funding, and that enabled them to share delivery. And so what's really important is that all of these mechanisms of value are really, really useful. But what's really important is that we're aligned and speak and clear about which one we're using. And the reason is so that we can structure our activities accordingly. So an event, for example, where people come together to share learning might look very different and have a very different setup and set of pre-work from one where we're primarily there to align plans or deliver together. Next slide. So what makes a collaboration effective? Well, Kaleidoscope, a couple of years ago, we reviewed the literature and kind of pooled our collective experience and expertise, and we developed a model that we use to help collaborations become more effective. As you can see up on the slide, we think that effective collaborations share these 8 characteristics. They have a clear shared purpose, a focus on building the right culture, and the resources and structure to succeed. And what we've done is we've used this model to develop a diagnostic tool that we use with collaborations to help them understand what are their relative strengths and weaknesses. So if you pop to the next slide, you can see an example of how we've done this. So this was with one ICB, where we worked with the ICB to do that diagnostic model, do that diagnostic survey, and come up with which are the focus areas where the collaboration wants to develop together. And what's been really nice using this model, if you put to the next slide, is by creating reports like this and structuring conversations around them, it's enabled the partners to actually align together and work together to figure out what's the areas that they really want to develop and how can they collaborate more effectively. So we were able to help give them a structure and a plan to think about their development and work together. So I'll hand back over to Rich now.
George, thank you very much indeed. And indeed, this is really the theme of our time together this afternoon in terms of how to be concrete about collaboration. Other metaphors are available, but how can we be really specific and practical about some of the actions you can take to improve your collaborative working? We aren't going to do exhaustive introductions today. We are going to be quite a big group, but we are just going to pop over to Menti briefly. Menti.com, you can either follow the link in the chat, you can go to Menti.com and enter the code there, or if you want to hold your phone up to the screen and scan the QR code, you can do that as well. But Menti.com, please, 62 16 02 34. Thank you very much. Menti.com, 62 16 02 34. And as is usefully labelled on this map, this is a map of the UK. Where are you joining us from today? Just a quick check-in. Where are you joining us from today? If you're joining us from beyond these shores, pop a little dot in the sea somewhere relatively in the direction of your joining us today. But where are you joining us from today? Wonderful to see that spread. Thank you. I'm very pleased, given that we have a speaker from Northern Ireland. We have a dot in Northern Ireland, but I fear, Heather, that might just be you, but it might be more than that. Good to see different corners of the country covered. The far tip of the southwest. We need to, the next one of these, if anyone's got any friends in St Ives who they want to pass on the message to come to one of these, Cornwall seems to be a black spot for these events. So maybe we'll improve on that for next time. But lovely, thank you. Oh, and a dot in the sea as well. Great stuff. Thank you very much. Menti.com, 62 16 02 34. Paula from Canada, very welcome to join us today. Primarily work for. Who do you primarily work for, please? It might well be, this is a session about collaboration, that you are joining us with a joint role. Fantastic. But who do you primarily work for? Claire, yes, indeed. We'll send you a travel budget so you can just boost our credentials. Thank you. Who do you primarily work for? Nice spread, quite bewitching, these data visualizations. National, local, other. If you want to put your other into chat, so we can see, that's great. It's good we've got a local government isn't absent, but relatively small. Cornwall and local government for next time, please. Thank you very much indeed. National bodies, local bodies, VCSE and acute and others as well. Thank you. Going to go on. Again, this theme about being concrete about collaboration. This one's a bit harder than the previous two. Just to take a moment, please, just reflecting on a collaboration that you might have been directly involved in. You might have just been, it might have been happening around you. You might have seen it from a bit of a distance, but reflecting to a collaboration that worked. What made it successful? Thank you for answers already coming through. If you've got any issue with the chat, then you can absolutely pop things into put in the issues with Menti. Do pop them into chat as well. That's absolutely fine. These are themes we're going to continue to pick up as we get bewitched by words shaping and reshaping and reshaping. Trust there, staying consistently largest. Trust, respect, shared vision, purpose, hard work, communicating regularly, friendships, humility, values. This is the point when all of our eyes start to hurt. So if you want to look away just for a moment as it continues to come together, again, we will be sharing all of this back afterwards as it comes together. Communication, purpose, clear purpose, listening, facilitation, like people, shared objectives, kindness. Lovely stuff. Thank you. One of the points we make at Kaleidoscope is all of this is quite intuitive. There is this divide between how intuitively we can think about collaboration and what makes collaboration work, but then how we really apply it in professional settings is sometimes that bit harder. Okay, we've got a settled set of words for now. Thank you. Trust, communication, listening, openness there as well. Thank you very much indeed. Last one. Then we're going to come to our speakers. Thank you, everyone. In registering, you gave us questions which you'd be particularly keen to be answered today. We picked the 5 most common themes which come through, but if we're going to prioritize further, if you're going to pick 2 of these questions in particular, which would you most like answering today? So you're 5 to pick between. So how do you manage power imbalances between partners? How do you keep collaborative delivery happening as funding gets harder? How can we effectively collaborate without excessive and slow governance due to the number of organisations involved? Are there any shortcuts? That's a lovely question. How do we avoid trying to collaborate on everything? Should we? Great question, that one. How do you demonstrate the benefits of collaboration to skeptics? If we're going to focus on 2 of these today, we will have time for questions, so we want to particularly get into these a bit later on. Which would be most useful for you that we focus on? Lovely. It's impossible to not infer from some of these dots people's day-to-day experiences. How can we effectively collaborate without excessive and slow governance due to the number of organisations involved? I'm sure that's the sort of question which I'm sure, like, I don't know, perchance an ICB chief executive might like to give us a view on, if only we had one on the call and was speaking in about 6 minutes' time. Lovely. Okay, great stuff. Thank you. We're going to come back to those in due course. We're going to come on to our speakers. We've got 3 speakers. I'm going to allow them to introduce themselves rather than horrendously mangle their extensive biographies from here. We're going to start with Heather. We'll come to Adam, and then we'll come to Ross. And the task, which we've set them, a nice easy task, is to speak without deviation, repetition, or hesitation about an example of how collaboration made a difference in their particular bit of the world. But then again, concrete, what specific steps made that collaboration work? If, as we go through, people would like us to post reflections or questions, just observations as we go, you are very welcome to indeed. Lucy, thanks for doing that in the chat already. So I think we're going to start with Heather. Good afternoon, Heather. How are you? Just want to unmute Heather. There we go. Lovely. Hello, Heather.
Hello, Rich. Better with the mute off. You'd think you'd know by now. So, will I just go on?
Introduce yourself.
Yeah, so my name's Heather Moorhead, and I wanted to give you a bit more of introduction than is probably necessary, but you'll see why. My background is I'm an environmental health officer. I led a sustainable development NGO in Northern Ireland. I then was chief exec of our local government association And then about 10 years, I moved across to lead the NHS Confederation in Northern Ireland. And this collaboration and thinking about how we get to better outcomes has largely been, I would say, pretty much my life's work. About when you really boil down to trying to get to better outcomes in whatever context, it really is about working differently. So again, anybody that's been in Northern Ireland will know this is a divided society. So although we have 1.9 people, and I am an ace networker, a super connector, and I know pretty much everybody, and you can get pretty much everybody in the one room, I could tell you 500 stories about where we've tried to collaborate and it hasn't worked, where everybody tries to collaborate from their own perspective. So community planning layered on integrated area planning, layered on economic planning, all of that. So you can see that where it doesn't work. But I think during COVID, we could see loads and loads of places where it did, where again, probably Ross will get into this, it's the design of the system. So my first day that I was in the office, our permanent secretary had me in for 2 hours. I was amazed. And he said, Heather, if you can do anything to get a more collegiate approach across our health organisations, that'd be amazing. I thought, flip me, no problem. I'll be able to do that, no problem. That's my gig. And I hardly could get it to work at all, because not because of the people, but the design of the organisation, how the money flows, how things get measured, and the relationships, the top-down relationships. So my key focus is on design. So the example that there's loads of examples that have been amazing, some that have been great. And again, working on a sustainable development agenda, I have lots of techniques that get to shared purpose and that get to the magic. When people come together in a different relationship and discover together, something else happens. Loads of examples of that. But the one that I wanted to talk about today is one in Newton Abbey. It's called Thrive. It's a population of about 7,000, highly deprived area. And what this young woman who works for Bernardo's has done is she's created a pooled budget that is held by the Department of Education, and she's worked on early years, and she's just filled it up. And that's really, really easy to say, but in a very hierarchical environment where people don't give away resources easily, this is an amazing achievement. But what she's been able to do is completely mobilize the community around the things that matter, working with the local population, or primarily focused on early years, but then moving back into families. And then she's getting loads of outcomes, but she's getting justice outcomes, education outcomes, drug and alcohol outcomes. We have NEETs, not in employment, education and training, all of those sorts of things. So at first people didn't know whether to give their money, and now people are phoning up going, we're trying to report the outcomes in the area are really great. Can we say that? And she says yes, because that's all part of the pooled budget. So she's got somebody else to hold it, so she's proper governance and a really strong governance framework, but she's done a lot of work to get everybody involved, the deep trust of the community. And I suppose my issue there is, and the point that I want to bring to the group is that they have shared purpose, that everybody in the area is working to make the area better. And she has done that brilliantly through using lots of different techniques to mobilize everybody and the intelligence of all the volunteers and the children. And then the organisations are supporting those people around place, because place is where you don't feel, oh, today I'm experiencing fuel poverty. Now I'm experiencing food poverty. Now I'm experiencing bullying. Now I'm experiencing something else. You feel those things all together. And when Claire talks about multi-solvers, when they're working in community, they've been able to change that. And even in working that, they've changed the nature of the relationships with the different government departments and the different stories. So that's my little story, but it demonstrates some of that. But I think it's the techniques, and again, maybe Ross will say more, it's the design of the way you're working, because there's 100 war stories that I've got that we haven't got it right. We've just said, let's collaborate, and it just doesn't work.
Heather, lovely. Thank you so much for kicking us off. We're going to show our appreciation from wherever we are. Heather, whether you want to use real hands, virtual hands, thank you very much indeed. So yes, point already, John making in the chat about the surrounding system affecting the causes to why people find it very difficult to collaborate. Bad system eating a good person every time. Again, other cliches available, but how you design a system to support people to collaborate, something I think we might get further into. Heather, thank you very much indeed. I think we're going to come to Adam next. Good afternoon, Adam.
Afternoon. Thanks for having me.
Adam, most importantly, I think we need to say happy birthday for tomorrow. Is that correct?
Yeah, thank you very much. I'm heading to 43, which is a pivotal moment for me tomorrow.
Congratulations. Adam, over to you. Do introduce yourself.
Thank you. So afternoon, colleagues, and for those that are dialing in, hello later. I'm Adam Doyle. I'm the Chief Executive of NHS Sussex. So I lead the Integrated Care Board here, but I'm also the National Director for System Development as part of my role with NHS England. So I've got sort of two hats that I'm wearing today. What I thought I would do is outline a bit of a history of my health and care system that I work within, both in terms of the history of it and how we've worked together to improve things, and then to give a specific example about something that we've got in terms of the evidence and data by which we've done that. So I've worked in the Sussex health and care system for just over 7 years, and when I was asked to go and lead that part of the NHS, it was not a system where anybody really wanted to sort of go and work, to be honest with you, because it was known to have a number of problems, which were predominantly, when you look at a purely health context, very much in the space of performance problems, quality problems, financial problems, governance problems. I like a challenge, so I thought I'd take it on. And when I did my due diligence for the role and understood what I thought the context was going to be and what was needed, but when I got there, I also started working there during the Southern Rail strike and lived in London, so it wasn't very good for my home life and my first year of my marriage, but that's a whole other story we won't go into just at the moment. But what I found two key features of that system that made me feel it was possible to help coordinate a leadership model that was different. The first, there were great people working with their communities, like amazing. The people wanted to do the right thing. People wanted to integrate services, people wanted to work together. But the system had found itself from a leadership context to only go into win-lose for everything, both from a commissioning context with each other, from an NHS provider context with each other, and also in working with local government and sort of wider non-statutory partners. So it was pretty tricky. And the sort of the leadership challenge I had was, how do you start to get improvement when everything's a little bit broken and nobody really wants to speak well of each other? And, you know, in terms of, you know, examples, our local authority would not join a health meeting. They just wouldn't come. They refused to be there. Our commissioning organisations didn't speak well of each other. They were very rivalrous. And our NHS provider organisations in that context sort of thought success was really them doing well at sort of, because that's how they were going to survive. So, but of course, all of that was pointing to quality problems, particularly patient safety issues, performance issues, and the money was going in the wrong direction. And we were, on my second week, there was the thing, for those who've been around the health and care system in England for a long time, that was the month that the STPs were rated. And unbeknownst to me, mine was rated the second bottom in the country. And I'll be honest with you, I feel a bit bad for the one at the bottom because I think we were a little bit worse, but that's okay. I'll take that moniker. So there's many ways to go about that and many parts of that I got wrong. But the key part that I realised very early on was most of the leaders had suffered a form of moral injury with each other. And their organisations had it. And they felt injury from everywhere. So therefore had closed themselves down. And wouldn't speak well particularly of each other, but also wouldn't confront an issue either. So the journey that I've been on with them all, and it's a journey that they have led and that they have managed a remarkable thing with their organisations, and we've seen changes of leadership along the way. But the first piece of my learning with this was the honest conversation is the courageous conversation, and how you have that in a way that starts to get people to connect to you as a person is really key. So I'm a behaviourist, but also I'm an extrovert that likes to be around people. But recognising all the different leadership traits that were exhibited in the room, I learned the way to somehow unlock it all was to be really, really to go to where they were, really. So some people with me need a glass of wine, some people need a structured meeting, some need a walk. The leaders were all different and their teams were so different. So the first bit I realised was to get them to start to collaborate, which was going to be the only route out of the kind of pickle they'd found themselves in, and I was now part of, was to first of all get people to speak really well of each other and to start to challenge when that didn't happen, and to have a really courageous conversation. And then you're like, oh wow, I've got to keep gardening this for like 3 years. So that's the key part. Collaboration does not come easily. It's so to get where we got to, it's really hard yards to get there. But my second lesson is, my goodness, holding on to it is even harder, because the world pulls us apart, doesn't it? Everything pulls us apart. So, and I know there's a governance question that I will answer later, but we create barriers too. We create things that mean we can't give of things, and you've got to go back to the human sort of predisposition of, well, why are people doing that? They're normally doing that because they're a bit scared or fearful. So the psychodynamic analysis between you and a human being is part of collaborating, and keeping that core is really, really key. And then once you get there, then you start to go, what could we do? Let's do something really small. And I had to kind of slightly select things that I knew couldn't kind of fail, because I had to get away of people going, look, that was pretty good, wasn't it? And then my third lesson, I've said it, but in a different context, in a leadership role, you have to be able to, in a role that I've got, both in my national and my local role, but particularly my local role, I'd say, you have a job to be a slight umbrella to enable the collaboration to occur. Because I work really closely with my colleagues in NHS England, and the pressure that organisation is under, I think, is managed much better than people say. But things come out at times in silos. So how do we therefore bring it together and make it not a silo for people to collaborate? So the last lesson that I've learned is the communication piece, about how you handle that to therefore keep the narrative together. In terms of global measures for our system, so we had a £500 million deficit at the beginning of this. We're now looking at roughly an opening position of about £30 million for next year. That's on a £4 billion budget. So some finance people would say it's break even, but my board would not. But there we go. But the other key part is, in every key area, we've seen quality improvements in the main areas that were problematic. There are still areas of improvement that my system need to go through, and we're not there yet, but that's really strong. The other key part that we've also seen, though, is if you look at all the staff indices metrics of all the organisations, they've all improved. So that gives you a sense about belonging, gives you a sense about feeling part of an organisation. And then the most important bit is, when you look at the patient experiential outcomes, there are still some that I'm not proud of, good grief, but by and large, the ones that were the most problematic have had an improvement trajectory that is pretty significant in terms of any statistical analysis. And that and I tell people all the time, we would not have done this without the generosity and the trust and the vulnerability that our leaders felt. So that's what took us there. And then lastly, in a system like mine, just under 2 million people, things go wrong, right? And we had a real issue about 6 months ago about numbers of people in the emergency department with mental health conditions. But by going to the way we work together, we've opened that up. We've reduced that by 75%, and we're able to work together going forward. So I suppose my ending of this is, it's an approach. I think it has to work in systems where the governance doesn't align. There's different statutory responsibilities. But if you can get people all in the same place on purpose, you can do some pretty amazing things. So I'm sorry, I probably overtalked, but that's the Irish immigrant in me. I apologise, but there we go. Back to you.
Not at all, Adam. Thank you very much, Steve. We'll show our appreciation from all corners of the country, not Cornwall, and Canada as well. Adam, I thought we were going to go into a story of collaboration purely through the lens of your marriage, but maybe that will come up in the questions.
Let's see.
There we go. Adam, thank you very much indeed. We're going to come to our last, but by no means least, speaker, and not to do one-upmanship, but yes, it is Adam's birthday tomorrow. But Ross, it is your birthday today. So I feel like we should all pause and sing you happy birthday. But happy birthday,
you, yes.
And over to you.
Thank you, Rich. And yeah, I'll put the gift aid link in the chat afterwards. Any donations, cards, greetings, gratefully received. But no, great to spend my birthday, share it with you, everyone here, and thank you for the invitation, and the contributions so far have been excellent. And hopefully what I'll present to you all can build on that and can provide us with a platform for discussion at the end of the session. So yeah, I'm Rossman. I'm the director of the Health Services Management Centre here at the University of Birmingham. Collaboration, integration of services and care is a key sort of ethos, a theme that runs through our work. And from my own personal perspective, it's something that I've been involved in from a research and education capacity for quite a few years. So what I'd like to do now is provide you with an overview of some recent research that we've completed that hopefully builds on, complements the work of Kaleidoscope and many others in thinking about how to get the most from collaboration. So I'll briefly present some slides to you if that's okay with you all. So yeah, next slide, please. As a quick don of the cap hat to our funder, acknowledgement of the NIHR and the team that's involved in this research. And there is the final report that was published last year, and there's various links to that. It's open access. So thank you. Next slide. So let's get to the crux here. George kindly sent through the brief, and I was given the task around getting the most out of collaboration, and where does that take us? And I think this hopefully complements, builds on what's previously said. Our research interviewed service leaders, policymakers, workforce. We had patient public focus groups, and in developing that sort of detail and thinking about the concrete of collaboration, we identified a variety of different contributions, that this idea of working across boundaries, joint working, what that can bring. So here's a flavour of what we found. Collaboration makes a difference in the ability to create spaces. It creates spaces for communication, and through that communication we can generate learning and shared understanding about our worlds of work and our experiences. And through that, and perhaps building on what Adam's just previously said, the communication and learning can open us all up for all the partners involved to exposure to methods and ideas about how we can improve services and how we can improve the experience for those involved. So there's a thread there with the communication, the learning, and the improvement, that sort of cycle there. There's also a factor to bring into collaboration, which is about why do we want to get involved if we maybe don't need to, but there's something about the reputation, the ability of collaboration to enhance the reputation of all those parties involved. And that might be useful in terms of a landscape where we're looking to work across internal and external stakeholders. The role of reputation management is something that might be useful for us when we're thinking about developing and nurturing collaboration. Next slide, please. Some of these quotes and reflections on these slides really talk to some of the kind of crux, the concrete foundations of collaboration, what it can bring. It brings oversight, coordination, and from that, what does coordination, oversight give us? It gives us opportunities to think about duplication. It gives us opportunities to think about economies of scale. And I think one of the points that our research brings out is the opportunity to think about scale, effort, and thinking about how we can support those, delivering at the front line, the workforce element of supporting duplication of effort and reduction in costs and economies of scale around workforce development. So I think there's some of the key concrete elements of collaboration that really map on what previously been discussed. Next slide, please. This slide is my final take-home message around successful collaboration. And again, it's that if we're going into this cycle of what the joint working, we're looking across boundaries, exposing ourselves to shared understanding, it creates opportunities to improve our services, stating the obvious, but crucially what collaboration can do, it can get us closer. Can get us closer to those that we are looking to serve, populations, communities, but it can get closer to our colleagues and our workforce and our teams. It's those dynamics and the ripple effects of working together that can create the benefits for all. So I think that's something that maybe we could explore further. Last point from my own perspective here is thinking through the practical next steps for collaboration. So we've had this making a difference. What are the next steps? From our research, we've got the three sort of pillars or domains about the need to build trust, key thing that's come out of the session so far. And on this slide, we've got some different dynamics and things to think about in building trust, the narrative, the shared vision, the ability to think about quick wins. So a key part of thinking about complexity, the many moving parts, is to think about scale, think about how we can work at scale to communicate to others that this collaboration is progressing and working well. That connects into this idea of building faith or belief in a collaboration. To sustain this work, as Adam has previously pointed out, that requires energy and effort. So it's creating conditions where we are sustaining motivation and thinking about how we can communicate to others that this is progressing and we should continue in working with others and working across boundaries. The last kind of domain of this research was about building confidence, and that's certainly in mandated environments. And I noticed mandated was on the Mendy visual. In those dynamics, it's about contractual arrangements, acknowledging power dynamics and inequalities within those power dynamics. And then it's something about when we're in those contexts, how can we think about and better understand where our various partners and others are coming from? So that's about due diligence. And that's also thinking about accountability in terms of how we're going to enter into a collaboration and how we can, again, going back to this point about progress and belief, how we can ensure that accountabilities are built in along the collaboration journey. So I think that concludes my slides hopefully in around 5 minutes. There's a variety of other outputs from this research. So yeah, please do contact if you'd like any further information. So thank you.
Ross, thank you very much indeed. Once more, we will say thank you very much in virtual and real the hand ways. And Ross, to ask you to present several years worth of research in 5 minutes, and for you to do so, and on your birthday, I know it's really quite a feat.
Thank you very much.
Ross, thank you again. If you're wanting to get any of the bits of these slides, we'll be sending those round to everyone who registered just after this. So watch out for those. Question in the chat, and then we're going to get into a bit of Q&A. But actually, just reflecting on what you've heard from Heather, Adam, and Ross, and sort of where you're coming from, whatever your local context is, what got you nodding your head most previously? What most resonated with you in terms of what you've heard from our three speakers? So what got you nodding most previously? What most resonated with you? in the chat, please. That would be great. I was just saying we're going to be we'll be writing a blog just reflecting on some of the themes coming through from today. So watch out for that as well. Needing to continue to actually nurture relationships on an ongoing basis, which will thank you very much. So for pooling budgets, needing to do that, keeping the faith. I'm trying very hard not to sing at that point, and what that requires. Ariadne, thank you. We'll allow people just to continue to burble away on that question, but as always, time is against us. So please do pop in responses to B1 in the chat. And that would be lovely. But we are going to come back to those questions which we threw blue ping pong balls at earlier. And what I might do is just ask each of our panel just to pick up one particular question. So what I might do is, Heather, I might come to you particularly about how do you keep collaboration going as funding gets harder, if that's okay. So Heather, collaboration and funding. Ross, I might come to you then on how do you demonstrate benefits of collaboration? I'm sure there's a research framework which we can use. And if not, quick, write one. And then Adam, we'll come to you about how can we effectively collaborate without excessive and slow governance due to the number of organisations involved. Are there any shortcuts? So we'll start with Heather, then go to Ross, then go to Adam. Heather, how do you stop collaboration from dissipating as money gets more and more short? And if you want to unmute.
Very helpful to unmute. So I think my reflection is, and my biggest learning is, if folk want to look up, or I'll send you the link for an organisation called Future Search. It's an American process, and they've looked at a lot of what Ross has talked about, and they've come up with principles that really make a change in the difference of relationship. And what they do is they go slow to go fast. So they pull everybody together in stakeholder groups because everybody's always in a hurry. They map out what's happening already, and people are amazed because you thought you knew, but you didn't. They co-create a vision for what the future would look like, so it's owned. Nobody gave it to them. And then the methodologies, the facilitation, and this is probably what I would like to major on, that when you've got neutral space, it opens up place for honest conversations. So you have to have honest conversations safely. And in my experience, especially working, local government are very argumentative, health are very nice, but then they don't always say what they need to say. You trot into a meeting, everybody doesn't agree, and then you trot out and everybody moans after the meeting. So if you could have a facilitated way and creative techniques, sticky dots, post-it notes, is everybody agreeing, you can get to a mechanism of actually getting what that agreement is. But it's that time that you spend together. And to be honest, that's where the magic happens. If I'm with you and I begin to understand that you're annoying me and you're the biggest thorn in my side because every time I go to do something, you moan or you block me. When you spend time, you actually discover together that you actually did want the same thing, and that begins to change the nature of the relationship. So those facilitated processes, and I'll send you some of what, but when you do take the time to do that, changes the nature of the relationship, and then people begin to act in each other's benefits when you're intimately connected to the outcome.
Heather, lovely, thank you so much. And I'm sure I'm not the only one who had a sudden flashback on meetings I've been in the past when you were describing some of the dynamics and tensions which can pop up. Heather, thank you. Continuing everything popping up in the chat, lovely. Please do continue that going. Ross, we'll come to you. So there are lots of collaboration skeptics out there. The phrase you sort of collaborate when you want to be nice, you sort of manage when you need to get stuff done, gets used quite a lot. How do you demonstrate the benefit of collaboration to skeptics?
Well, I think it kind of touches quite nicely on what Heather's previously described in the vision of collaboration and building a story narrative about why we work together and why we should work across different boundaries is built on the authenticity, honesty, that exposure to, exposing yourself to some vulnerability kind of connects to this idea of trust and building relationships. but the benefits, the value that's generated from that that's the richness. That's where the gold is, that you can generate more than what you can do on your own. More than that's kind of goes back to the crux of collaboration, that you can generate value and benefit beyond being a sole trader. The collective is key, and to realize that, there's just the two more points I'd like to raise is the importance of scale. We're working in complexity, lots of moving parts. So thinking about how we work at scale to generate progress and communicate that progress, that's a really important axis for us to extol. The virtues, the benefits of collaboration is creating the spaces where we can see this collaboration is working. It means something and it's important. So scale connects to from narrative, and then method measurement. I think Adam provided some really good insights into measures that show what can be done and what can improve. So I think that's an important thing to take forward. So I hope those 3 points would help answer that question.
Ross, lovely. Thank you very much indeed. I'm enjoying how people are now just trying to get Heather involved in other regional issues. You can continue that. If you think there are Midlands-based problems Ross can solve, again, suggestions in the chat. Adam, this issue about governance and about how you marshal lots of different competing views at a time when we've got such urgency for change. How do you square those things off?
A few things. First of all, it is really important you understand the legal responsibilities of your own individual organisations in your ecosystem. I know that may sound a little bit like bureaucratic, but just knowing what they actually are and what they are all there for is really, really important. Because so for example, in my system, we have just agreed an NHS committee together to make big strategic decisions about change. But when you lead with governance changes, everybody has a meltdown. You've got to be what is the purpose of it? And the purpose of this is, we believe if we make decisions together, we can move things faster, because you want to improve outcomes quicker. And so first of all, we want to improve outcomes quicker, right? We all get frustrated with going to 8 boards to sign something off, don't we? We do. So shall we change the governance? Okay, how do we do that? And so the bit I give lots of challenge to people when I visit different systems across the English health and care system is all organisations have enough governance latitude to make decisions really quickly should they choose to. We can often seek for another bill or another, if only that thing was right, or a different thing could be done to fix it. So therefore, if you start with the purpose is about transforming a health and care system, what are the must-do things and how to get that piece right? And I think when people say things like the governance is too complicated, or I can't get my board to agree that, or I don't really understand what we're doing, it's telling you something quite profound about where they're at. So I think my advice to everybody who's trying to do transformation, all your leadership community have the ability to affect change. But what we're not doing, I think, is at all times creating a psychologically safe place for people to feel able to bear risk with each other. And you will only bear risk with somebody that you trust. Trust is only gained by proving you can be trusted. So it's those simple things, but I think we use governance as a blocker because we don't want to confront, I think, at all times, the same issue. So the shortcut is you tackle the behavioural elements, you tackle the how people operate and interact with each other. The governance comes second, and never ever lead a meeting with I've had a great idea, this is the governance chart, because it sends everybody into a very, very strange place, really.
Adam, thank you very much indeed. Once again, we will be sharing the recording of today's session. That is, if it gets through the Kaleidoscope recordings, open brackets, webinars, close brackets, committee, which is meeting next March, I think. And so we might release it after that. And pending that, we might come back to something. But Adam, really, really nicely put. And how do we best support that building of trust at a time when things are pressured. Heather, we were talking about how the funding affects and how that cuts in. Well, I don't think anyone here is proposing that any of this is easy or uncomplicated, but neither is it impossible. We have 5 minutes left. We've got 5 minutes time. Where does the time go? What we're going to do, we're going to come to our panel just for a closing reflection in just a moment. So just one quick fire piece of advice. We will start with Adam, we'll go to George, we'll go to Heather, we'll go to the birthday boy for the final word. But whilst that's happening, in the chat, please, C1, what stuck out for you? So when you bump into someone in the corridor or another Teams meeting following today, what's the one thing you're most likely to be passing on? Whether that's a tip, an insight, an observation, what is that one thing you're most likely to be passing on to other colleagues? In the chat, please. That is C1 in the chat. Thank you so much for the activity in the chat. So quick fire, please. One piece of advice to close. Let's go. Adam, George, Heather. Adam.
And really quickly, it's a people game. So therefore, the trust is really key. And therefore, if you tackle that, most of the rest of it should be able to fall into place.
Adam, lovely and very succinct. Thank you. Let's George, Heather, Ross. George.
Be really clear on purpose and think about how your collaboration is going to create value.
George, thank you. Heather, then Ross. Heather.
I think get facilitation. So do something differently, because you can say get trust if you keep going at it the same way with hierarchical things, you don't change. So a facilitator changes the dynamic, new possibilities.
Lovely. Thank you. Ross.
And following on from facilitates, this creating spaces to connect. So that's physical, virtual, but that I think will be a key next step. Thank you.
Ross, thank you very much indeed. Thank you for everything coming through on chat. What happens next? Well, you might be sitting there going, whoa, feel a bit battered by that session. That was pretty intense. Yes, very much. What we've done is try and throw a huge amount of content and insight at you in a very short space of time. What we'd love for you to do, so we're going to share the recording, we'll share the slides, there will be a blog, we'll make sure that all of the insights from chat do get captured. And we do hope that this sparks sort of further conversations within your organisation, within your collaboration, about the art and science of how we can be more concrete about collaboration. What does it take for us to go beyond saying, oh, it's nice to collaborate, to say, no, what matters here is to collaborate really well. So thank you again for everything coming through in chat. That is lovely. Once more, as Kaleidoscope, we do a whole range of things linked to how to work well together, whether that is research and evaluation, strategy development, organisational development, service change, but collaborations and system support. If there's any of that which we can ever help you with, we'd be delighted to hear from you. Please do get in touch for a coffee or tea, or other beverages are available. Do sign up for our free newsletter, and other events are coming up thick and fast, so do have a look at the website to keep track of those. The next one of these series of webinars is the 21st of March, and not entirely just because we want to hear beyond the walls of England, Northern Ireland and the UK, but we do want to think about how are other people in foreign shores thinking about some of the issues which we're grappling with. So we've touched really nicely today on the leadership challenge within systems. That's what we're going to be focusing on the 21st of March, drawing in international perspectives into effective systems working. So please do join us for that. There's an evaluation form in the chat. There's lots more on the Kaleidoscope website, but I think that's probably enough for this afternoon. Many thanks indeed again to Heather, to Ross, to Adam, to George, the whole Kaleidoscope team behind the scenes. Thank you so much for joining. We will be in touch with all those resources, but for now, have a very nice rest of your afternoon. And we hope to see you again at a future Kaleidoscope event. Thanks all.